Assalamu alaikum, everyone. My name is Muhi Khwaja with American Muslim Community Foundation, and today on the Muslim Philanthropy Podcast, we have on our guest Parweez Mohammad from the Bay Area Community Health. He is their health services advocate. Welcome to the show, Parweez.
Awesome. Thank you for having me.
Of course. Why don't you tell listeners a little bit more about yourself, kind of where you grew up and your journey to Bay Area Community Health?
Well, a little bit about myself. I grew up here in Fremont. I spent a couple of years in Hayward actually in my early childhood, and then we moved back to Fremont basically. For a majority of my life, I've been, homegrown. In college, I attended the first 2 years at Hayward to college, figure out, what I actually wanted to do before moving forward. And recently, last year, I graduated from UC Davis with a major in English and critical theory and a minor in theater and dance. And after that, basically my main focus was, trying to figure out a way to contribute to my community, to try to, have an impact and interact with people because I felt that what I was really missing was a lot of experience out in the real world, interacting with people, trying to figure out, how best I can use my skills and talents to support my community. And that's basically what led me over to the folks over at Bay Area Community Health. I found that, their ideals, what their mission was trying to do, and just the things that they were looking for in terms of a health services advocate, which was, someone who was willing to interact with the community, reach out, make new connections, and just, spread all of these wonderful services that people really need in the community outward really resonated with what I wanted to do at the moment. So that's a short version of how I found myself here.
Nice. And in terms of Bay Area Community Health, can you share a little bit more about like how long they've been servicing the community, and then we can go specifically into kind of the work that you do there as well.
Yeah, I'd love to. So Bay Area Community Health was actually formed this year through a merger between two nonprofit health centers. So initially, Bay Area Community Health was made up of Tri City Health Center, a Fremont based organization that has been here since the 1970s, and Foothill Community Health Center, which served the San Jose Santa Clara County area since about 1996. About I believe May or June of this year, both organizations decided to go through a merger, and we came out as Bay Area Community Health, combining over 70 years of work experience and service experience for the communities. And with that merger, we essentially became the largest federally qualified health center in Northern California.
Wow, and that's also a really expansive area that you're serving as well, over a few different counties. So, in terms of just the leadership team and the transition, and going through that change, what were some of like the learning points that you came out of with?
The transition learning points that definitely came out was, adaptation, because at Tri City Health Center, we had a very grant based focus, whereas Foothill Community Health Center was a very enabling service based focus. So, just the merging between, larger projects and small community focus and balancing the two really helped us find this nice even ground in which we're still pursuing large grants and we're still pursuing like big scale projects to assist the community, but we're also focusing in on our current patient base and allowing all the care and questioning that needs to be done to be taken care of so we can please not only our community but also reach out to external communities. Since our service area did expand from just Alameda County to including everything from Union City all the way out to Gilroy, we're definitely trying to make it known that we're here to help every single individual that wants to receive our assistance in these areas.
That's great. And then, as a health services advocate, what are some of the different initiatives that you're bringing to the Muslim community across the Bay Area?
So initially, prior to my assistance with Bay Area Community Health, what I joined into was basically we had minimal outreach towards the Muslim community. And with that, I wanted to bring a little bit of my experiences and a little bit of my connections inwards. So when I joined, I immediately touched base with a couple of people over at the Sunday Islamic School Foundation. I contacted my previous principal of that academy. I attended it for about a couple of years, Imtiaz Bai. He also assists over at the Islamic Society of Fremont, Masjid Zakaria. So I pretty much connected Bay Area Community Health over to the Sunday Islamic School Foundation, the folks at Masjid Zakaria. I reached out once at Masjid Zakaria to the CARE Foundation. So in addition to, having a basic outreach towards, the general mosques in our area, like, the Islamic Center of Fremont, the Islamic Society of East Bay, SISF, things like that, I also began to outreach to other organizations like CARE as well. And so touching base with those people, I was able to, provide them with resources, flyers, materials, opportunities. We table at a few mosques now and then, just to, get awareness within the Muslim community about these resources that we have at Bay Area Community Health.
Yeah, I think that's really important. And what are some of those resources that BAC provides to the community overall?
So a couple of the resources we have is initially primary care. So we have a lot of physicians, multiple clinics, about seven in Fremont and seven in the Santa Clara Foothill area as well. So those clinics provide services like primary care, behavioral health, dental, vision, acupuncture, chiro, podiatry, pediatrics. Along with all of these, we also have, we could refer you out to specialists and things like that. And in addition, we have enabling services. And for those, we have an enrollment department, which is where I specialize in with being a health services advocate. We can help anyone enroll in any of the four public health programs. So if you're looking to enroll in programs like Medi-Cal, CalFresh, which was food stamps, Covered California, or Health Pack for those of our brothers and sisters who are undocumented, we can assist start to finish in the enrollment process for any of these programs, and it's at no cost to you for those ones.
That's really great. And, just knowing the challenges across the entire Bay Area, one of the most expensive areas to live, also where the low income level is at like $104,000. So just there's a lot of challenges for people making ends meet in the community. And it's great to see that BAC is providing those services to the community as well. So, we got introduced to one another through the Bay Area Census Engagement with the Muslim Community grant that AMCF participated and launched earlier in 2020. So tell us a little bit more about the census work that BAC was doing in the community as well.
So for the census, what we started off doing was, fielding our own ground. So we opened up a couple of tablings at our local clinics in order to, ask the patients that were incoming, have you completed the census? Have you heard about the census? Is there any questions you might have about the process? Because a lot of things that people were worried about in regards to the census was information protection and legitimacy. Because, it's a cut, although it's only 7 questions long, the census still asks you, essential things like, your home address, people's date of birth, names and ages, members in the household. And that kind of stuff is, very sensitive information for a lot of community members. So after starting off within our clinics, we decided to branch more and more outwards. We started to present census information and offer to help people complete the census at our external tablings whenever we assisted at other organizations, visited other locations such as, the Fremont Unified School District, Newark Unified School District. When we go tabling at other places like food banks or other locations, we would always make sure to include census education materials, census flyers, and just anything else on hand. In addition, we started to phone bank a little bit more around that time. So we were answering the phone lines and making sure to not only when we were providing a list of informational materials for, people in the community, we also included census education as a part of that and even offered to help them complete the census over the phone. Now, midway into the census outreach, we did get hit with, the 2020 pandemic. So we definitely had to change our game plan across there. Since, physical outreach wasn't really the top tier quality activity that we were going to get effectiveness from at the moment, we switched more towards a virtual session. So we started to, interact more in, providing presentations or podcasts for, organizations that requested it about either the organization or public health programs. And so we added things about the census into those as well. Along with me touching base with my care contact from the Muslim Care Foundation, I attended a couple of their virtual sessions, spoke about the census results once or twice, that we were getting feedback from the Alameda County, progress on census, communities that we needed to target a little bit more strongly, and just letting brothers and sisters know, what are the legitimate census resources and what they legally have to and what they legally don't have to, answer for those applications.
Yeah, I think, hopefully as many, what did you see the um, results being for census engagement overall in Alameda County or Santa Clara County? Have you been following up with, those results that came in earlier this year?
So from the results that we found out, we hit around 70 to 75% of the people within Alameda and Santa Clara County, this whole area, which was really good. It was up about 10% from the 2010 census, which was really helpful. Based on, what I was speaking to with people, it seemed like a lot of people were unsure, what the point of the census even was, which is
Mm,
completely understandable because,
sure.
it's something that only happens every 10 years. And so a lot of people tend to think, what good would my singular census application be for the community? But it was more about, raising awareness because sure, one census application may not make a massive difference, but you filling it out, including all of your family members, and then potentially bringing it up at some point, spreading it, bringing the awareness out, bringing other people secure and confident in completing the census as well. Like, oh, say you did the census, then your friends would most likely be motivated to do it as well. If they found out, oh hey, they did it, it's I believe that person, so I should trust the census as well.
Definitely. That multiplying effect hopefully really resonated and encouraged more people to participate. So, for those that don't know, like what are the key main points in which the filling out the census will help the overall community?
So the census is where we get all of the state funding for these programs that we enjoy, like Medi-Cal or CalFresh. These programs pretty much derive all of their funding from the results of the census. I believe it was like for the next 10 years, every person that gets counted is about $1,000 of funding each year to the state. So essentially, one individual completing a census application for themselves alone would be worth $10,000 over the course of the next 10 years. And so this is the funding that we could use to make that program more expansive, include more accepting income thresholds for those programs. And it's not even for just programs like this, it's for the development of the communities. When roads need to be repaired, when more schools or more housing or more development projects for communities need to be, pretty much paid for. The funding from those projects comes from the census directly. And not only that, but the demographic information you provide on the census is what helps us figure out what needs to be built where. If there's a lot of children located in a specific area according to the census, we're more likely to build, libraries or studying rooms or recreation centers or things that would assist children. If we have a higher population of elderly, we'd be more inclined to build, elderly low income housing apartments, recreation centers for seniors, senior parks, things like.
That makes a lot of sense. And, hopefully showcasing that Muslims participate in the census will also bring more, civic participation and resources to communities where Muslims are across the country as well.
Definitely.
Cool. So, thank you so much for sharing more about BACH and the census program that you worked on. I wanted to just ask you in terms of your personal favorite nonprofit organizations that you like to support.
Well, if we're not counting Bay Area Community Health,
Sure.
my next top three would definitely have to be, the Tri City Volunteers Food Bank. I do a lot of interaction with them. Right now, they're currently working really hard to provide, food services to individuals. They have weekly food give outs. I believe it's now Tuesday through Friday from 9 a.m. to 3 p.m. in the Fremont area. They've been, having people line up and giving them out boxes of food for individuals who need it during the pandemic with, all the job closures and things like that. My next nonprofit would have to be one that my uncle actually got certified and started this year. It's called Hand to Hand Sadaqah, and it's basically focused around, gathering funding and donations and things like that in order to send it over to the brothers and sisters back home in Afghanistan so they could, build wells for their communities to have water, have wood for fires, have just basic food and supply so we can support and take care of our brothers back home. He's currently putting together a team over there on their end so that they could have a more smooth transition of information and resources from here over to there, which is really wonderful. And then probably the third nonprofit that I've interacted with would be the Humane Society for Silicon Valley, just basic the animal shelters over there. I have a soft spot for animals. They're just really adorable and every once in a while when I find a stray or something, I try my best, hand it over there somewhere that can take care of, not only people but animals in the community as well.
No, I love that. And I have a dog and a cat myself, so definitely see the soft spot there. In terms of the work that your uncle's doing, and also other community work that you're part of, do you know where people can find out more information about those specific projects?
For TCV Food Bank, they have their own website online. You could just search up into Google Tri-City Volunteers Food Bank, and that
Mm-hmm.
information will come up. For my uncle, I believe he just started a website. It's pretty much called handtohandsedekagroup.org.
Great.
Sedeka is SADAQ.org. So
Mm-hmm.
that's definitely a place to touch base with them. I'm sure Humane Society of Silicon Valley has
For sure.
their own very popularized website and advertisements already.
Yeah.
But for those organizations, for BACH right now, a big thing that what we're doing is COVID testing. So with the whole pandemic that's going on right now, we have taken on a couple of grants and we're beginning to have pop-up testing sites. So in addition to testing at our own clinic at Monterey, we have pop-up testing sites. So what that means is basically they're going to alter locations every week. We're booking different testing sites. We're trying to have at least 3 or 4 each week. They're all open from the same time frame, 9 a.m. to 4 p.m., and they are at no cost. And we are not, some testing sites are saying, you have to display symptoms or anything. We have no criteria requirements to get tested. We're just trying to get as many people tested as possible so people can know whether or not they need to isolate, stay safe, or if they're currently good with their, setup at the moment. So we are having these testing sites weekly. If you go to our website, bach.health, BACH.health on our COVID tab, we have our pretty much testing sites all labeled there. They're going to be continually updated, and we're planning to have testing sites all the way up until February of 2021 at the moment. So it's definitely like a good resource for people to have right now.
Yeah, definitely. I'm really glad to have the opportunity to chat with you. Is there anything else that you'd like to share with the listeners of, maybe, how they can get involved with, or your experience to Bach Health, and like how somebody can do something similar in their communities, or what advice you have for people who are interested in health services?
Well, advice for people in health services, for if you're looking to interact with something like BOT, you can find more details like that, including volunteer and career opportunities on our website. For starting something similar to BACH, if anything, I think right now what people need most in our community is, that sense of bonding, since we have had a sort of physical severance from, other human beings, just being more open, taking initiative, starting town hall events online, starting sort of Zoom meetings or things like that, recreational things, help each other self-care and take care of each other, providing resources, sharing these links, like when we find out about nonprofits, food distribution, things like that, just spreading it out there through social media, through other meetings, or just word of mouth to let other people know that these resources are out there is the number one thing that we could do right now to support each other in times like this, especially since we are in a semi lockdown at the moment with how the country's kind of going.
Yeah. And, I think California has been pretty aggressive on their recovery efforts. And, even I heard as of yesterday, Santa Clara County only has 50 more ICU beds available. So, obviously, hopefully, the community can come together and do what they need to do to stay safe and mask up, and try to avoid interactions as much as possible.
Definitely.
Well, I really appreciate your time in educating us all on Bay Area community health, the work that you do, and really appreciate you coming onto the show.
No problem. Thank you so much for having me. I was just glad to have this opportunity to speak with the community and just let everyone know that there's always someone out there who's willing to help and put in the effort to take care of them. They just have to, reach out. We'll be
Definitely.
here.
Great to hear. Thank you.